Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Dr. Stephen Brownstein here, host of the Dynamic Radiologist Podcast, where I feature top leaders in the health field and what they are doing to change the world. Past guests and organizations I've worked with include Rutgers, New Jersey Medical School, Newark Beth Israel Medical Center, and many more. I have Dr. Jeremy Weiss here, who has done thousands of interviews with successful leaders and health professionals. We've flipped the script, and he will be interviewing me today.
Dr. Brownstein, I appreciate you having me. And, today's topic, we're going to talk about, when you go to a medical professional or a facility, it can be scary. You build up this whole thing in your head of what it's going to be like. You and I, we kind of live in these environments. So to us, it's normal. But a patient who's never gone into a facility, they just don't know what to expect sometimes. So we're going to talk about some of the common worries or concerns before people come in, and should they be actually concerned or not. And before we get into that, the episode is brought to you by Dynamic Medical Imaging that I know you started over 16 years ago. Listen, Dr. Brownstein has been a board-certified diagnostic radiologist for over 40 years. Okay? I think you forgot more than most people know, Dr. Brownstein, on this topic. And so if you're a New Jersey doctor, you can, they have patients all over New Jersey, doctors referring to their facility. You can check out dynamicmedicalimaging.com. Now, doctors all over the U.S. refer to them to read imaging. You can go to thespinalkinetics.com. They've developed a technology, a CRMA, that actually does specific analysis with X-ray measurements. So check that out. So Dr. Brownstein, there's a lot of concerns that people build up in their head. Some are founded, some are not founded. One of the biggest concerns, especially for MRI, is people feel like they're going to be in an enclosed space and claustrophobic. So talk about that for a second.
Yes, Jeremy, that's probably the number one concern. In fact, at our center, 25% of people that come here have either failed at other centers or are afraid to go to other closed imaging centers, closed machines. We have Upright MRI. Most of the time, patients are done sitting. We even allow patients to come in ahead of time to see exactly where they're going to sit, what they're going to do, to ease their apprehension. So by far, that's the most common concern that they have. Obviously, with the COVID, they're concerned that we do all the necessary precautions, and we do wipes, wearing gloves 6 feet apart. So we do what we had to do as far as that. The other, concern or areas where patients that may not fit in a closed, I call it a coffin. Here we can do up to 400-pound patients.
Wow.
So they get the tests that they need. The other thing, it was interesting. Yesterday I went to visit a doctor's office, and I became almost physically ill because of all the commotion, all the people running back and forth. Here, it's a nice, serene atmosphere. Patients obviously spaced 6 feet apart. We actually built the center ourselves, and the money that we saved by doing it ourselves, we invested to make it a warm, comfortable environment. We obviously hope patients don't come here unless they need to come here, but if they do, we treat them like family. They're received warmly. The technicians explain exactly what's going to be done. I answer any questions. I'm here if they have any questions. A couple of patients asked whether I could review the studies with them prior to leaving, and I do that, or did that. Now it's a little bit difficult with the 6 feet apart, but we've done that in the past. So again, claustrophobic patients. They can
talk about the claustrophobic. So you said 25% have failed at other facilities. So what's different about yours? Why can they go into yours and not in these other ones?
Because the only thing between them and the TV screen is air. They're sitting down watching TV. There's nothing, unless they have a brain study where you had to put a special coil on. there's nothing between them and the screen except air. Other places you have to lay down, and usually there's a camera that's above you or a true coffin where you split in, and
that's what most people picture, probably. Like, that's what I picture when I think MRI. Like those TV shows, you have this coffin, and then you slide into this closed setting. That's what I picture.
well,
So you're saying you're sitting, like, just to describe it for people because they can't see it. They're sitting, and then there is something right in front of them.
they're sitting. There's nothing in front of them except probably 8 to 10 feet, and then we have a large screen TV on a wall. So between their eyes and the TV is just air. So the magnet's constructed that the two magnets are on the side of you, not on top and bottom. So that allows us to, do most of these patients that couldn't be done or don't want to go to a closed unit, or the truly open MRI.
So what do you instruct them to do? Like, do they just have to just hold still as much as possible, or what's the instruction?
Sorry to interrupt, but yes, they have to hold still because motion destroys the images. So, excuse me. That's what, the technician will say. We have next sequence will be 3 minutes long. They have a panic button, so if they have any problems, obviously they can hit the panic button. But just, they'll explain what's going on, and they can get through it that way.
Now, it's also, so if someone's sitting, I can also imagine some people can't lay down, right, in general, because of their condition. What are some conditions where literally they probably can't even get into that laying down position?
They're extremely kyphotic, bent over like a pretzel, where they can't lay down physically. They can't lay down. Obviously, they can sit, so we can do that. Also, patients that have respiratory problems, chronic obstructive lung disease, that have difficulty laying down without having oxygen, they can sit up, have their studies done. So those are, the two, other than claustrophobia and weight-related issues, we see a lot of time.
What are other concerns people have? So claustrophobia, which if they're getting that type of imaging at your facility is not a concern, but maybe it's built up in their head, and they can't positional. What other concerns do people have coming in when they're getting the studies?
A lot of patients these days have stents, so they have stent cards and say whether they're, are MR compatible. Hearing aids we can't do because they're magnetic principles, the construction of them. TENS device or muscle stim. Some we can, some we can't.
Like implanted ones, like someone is implanted.
We do. We ask the patients ahead of time when they're scheduling. We also have them fill out a questionnaire, and the technicians also ask them. So basically, we have 3 lines of defense. And the other thing is if they have metal, if they've worked with sheet metal, we'll do orbital x-rays to make sure they don't have any metal in their eye that could move. If they've gotten shot, unfortunately, some of our patients have. Depending where it is, it may or may not be able to be done.
Like if there's a fragment of the bullet still in them or something?
The nice thing about the MRI we have is there's sequences where we can reduce the artifacts that metal creates, so we can still get diagnostic images because of that. Whereas high field, they have more difficulty because the metal artifacts become much more prominent the higher the field strength is of the magnet.
So besides those, there's a bunch of contraindications of getting MRI and also claustrophobia and positional. Anything else that people are concerned about when they come to you?
Those are the main ones, Jeremy.
Yeah. Okay, cool. And what's interesting is, were there anything besides that for the cervical or lumbar? Is it the same position that you do for the different areas of the body, or?
Well, the head, neck, head and spine are usually done sitting position. Whereas when we do shoulders or knees, depending, especially shoulders, they may have to lay on their side in order to fit the shoulder in. to do it. But majority of the patients are done sitting. I'd say 80% are done sitting.
Yeah, I want to just tell people, Dr. Brownstein, that they could check out other episodes of the podcast, especially there's one that we talk about lumbar spine discoveries. What are things that they did not expect to see on there that were on there anyways? And sometimes they could be life-saving. So if you have questions, you can go check out dynamicmedicalimaging.com, contact them. If you're a doctor referring in New Jersey, if you are a doctor anywhere else, you can check out thespinalkinetics.com. Dr. Brownstein, thanks for having me.
Thank you, Jeremy.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.